waiting to be able to take a family member home from the hospital, and not quite sure when to go to the hospital to pick them up, trying to get messages through to the right caregiver to give them the okay that it was time to come and get that person and take them home. And the answer they got after several calls is we're trying to reach the on-call doc to give us the okay to take that patient home. And then after 2 hours or so, we've been calling the wrong physician. We found out we're trying to get the right person. She's not available at the moment, but we have a message out to her. So hours are going by, right? And then finally get the okay. We believe it's okay, but we're waiting for the final report of a study that was done yesterday, but we don't know. We don't have the results, and that doc hasn't reviewed those results. You see where I'm going? This was 6 hours waiting to find out, is it time to go and get our loved one and bring them home? And then once they did get home, they had questions. And something was unclear about what the follow-up should be. I'm trying to sort of stay distant from the actual details. But the 6-hour journey to determine that they could bring their family member home turned into a 4-hour odyssey to figure out how to ask and relay a question back to the team that had sent the patient home. Guess what? Shifts had changed. New doc was on call. Now trying to find the right on-call provider to go to the set of orders to clarify something. And at one point they called me and said, should we actually just take her back to the ER? And my thought was, please don't. Please don't. She made it through the hospital and was discharged. So let's not re-enter the hospital through the ER and start the cycle all over again. It all did get worked out, but it was some 12 hours from beginning to end, and I don't think it has to be that hard. So imagine if everyone is communicating, going back to the breaking down barriers, able to exchange information and talk near real time electronically. A lot of that time could have been saved, and if the patient and family had questions, they could have very easily linked back to the providers who are now on call, because you could get directed to them, to the right person at the right time,